ER doctor leaned down on his knees and looked at me and said that I needed to go into emergency surgery right away. What is the best diet to follow with gastroparesis if you can't eat by mouth? I tried many dietary interventions prior to having to resort to TPN. I don't feel that there honestly is a best diet. I know that people say that like liquid foods or an all liquid diet is the best. We are all so individual and we all have different underlying conditions. So what works for one patient may not work as well for another. But technically speaking, because the stomach can't contract, following a liquid diet is supposedly the best. And low fiber and low fat. Before I got my tube, I was doing a lot of Ensure clears, juicing, fruits and vegetables and produce in general. They do have high amounts of fiber. But when you juice them, now I'm talking juicing, not blending. Juicing takes that fiber out of the fruit or vegetable. When you blend to make smoothies, that still leaves the fiber of the fruit and vegetable there. So the body still has to work to digest all of that fiber. It is just in liquid form rather than a solid form. I was also drinking Glucernas, Orgain. Orgain made me sick. Man, I did best with rice, yellow squash steamed until it was practically mush, and when I was eating a meat, I did tilapia fish. How do you deal with public embarrassment around food? When I was younger, I definitely had public embarrassment about food because people would always comment like, why aren't you eating more? If I would go to a restaurant, I would order off the kids menu because I couldn't eat a full meal, and why pay so much money for a large entree that's just going to go to waste? It's just something I've had to learn to push through and ignore, and it got better with time. Sometimes I'll joke about it. Like at a restaurant, I'll say, oh, I'm a cheap date. What does the process look like for a doctor to decide if a feeding tube is the right intervention? That is also very individual between the patient and doctor. For me, mine was based on my weight. Some people, even though they're technically starving, they gain weight instead of lose weight. So weight is not something you can solely go on. Doctors also look at labs, vitamin and mineral deficiencies. Like, is your iron okay? Is your vitamin C low? Vitamin A, B? They can test trace minerals like copper and selenium. And there are all kinds of pre-albumin levels that definitely can assess nutrition. Are you spilling ketones in your urine from malnutrition? Are you able to stay hydrated? Those are all key factors. Even when my weight got low enough, I still opposed the feeding tube for a couple more years. And I managed, but it got to the point where the malnutrition was just wearing on me. And I had no energy past noon. I'd wake up at 10 a.m. I had about 2 good hours of the day. And then the rest of the time I was stuck in bed because I had no energy because I was starving. So that is how I came about to have a feeding tube. Someone also asked about my DJ tube experience. Before they resorted to a DJ tube, we went to an NJ tube. And an NJ tube is a feeding tube, a nasogastric feeding tube that goes through your nostril, down your throat, through your stomach, through the duodenum, which is the first part of the small intestine, and into the jejunum, which is the second part of the small intestine. And that provided me an opportunity to see if the feeding tube was going to work for me and to find a safe formula before they decided to surgically place a feeding tube in my abdomen, because it's a big change to have a surgery to have the tube placed if it's not going to work. They did that. I was on my NJ for a month on Peptamen 1.0. Worked like a charm. This was before my mast cell disorder became severe and I stopped tolerating the Peptamen. But I felt a difference almost immediately when I started feeds. I had energy again. I was still only going to school part-time, or physically attending school part-time. I did the rest online, but I had energy to actually have a life, and it was wonderful. I did feeds for 12, well actually, once I got my GJ, I did feeds for 12 hours, and I ate the other half, but initially to put weight back on, I was on 24-hour feeds with my NJ, and then I was encouraged to eat if I could. Then I got my surgical GJ placed right here in my abdomen. They can do it through endoscopy or surgically. Mine was surgically because I have altered anatomy. I had a post-op infection after that GJ2 placement that was very unpleasant, and it developed into a large abscess, and I had a 102 fever and terrible pain. At first I was managing with just IV Toradol, which is an IV version of Advil, and Tylenol IV, and I would alternate those. And had I not had the post-op infection, that would have been completely suitable. And even at the very beginning, like the first day, it was fine. But as the infection grew, the pain just kept getting worse. And then my fever came on, and I kept telling them, I'm like, okay, people, this isn't normal. They just kept saying, oh, you just had surgery, it's normal to run fever. And I'm like, but I never do. I've had many surgeries and I never run fever. I ended up being discharged anyways, and I was back 2 days later with almost 103 fever, and Neurobacter was what the culture came back as from my stoma. But once that healed up, then I was back to my normal within a month. How long did it take for your body to adjust to TPN, and how long did it take to mentally accept it? I'm not quite sure how to answer this question. My body's never responded well to TPN over the many times I've been on it, and I've been on it now for the last 2 years, but before that I was only on it for brief time periods. I never really gain weight on TPN. They can give me more calories than they give a grown man. The pharmacist gets very frustrated because it doesn't matter what they do to it. I don't really gain but a pound or 2. So that is why I'm still 80 something pounds even on TPN when they're pumping it all into me. Why? My metabolism. But I did not experience problems with refeeding syndrome, if that's what you're getting at. As far as how long it takes to mentally accept TPN, I don't think I ever truly will mentally accept TPN. I'm very stubborn, and I don't want to be on TPN for the rest of my life. My goal would be to do part TPN, part eating or feeds, but that's contingent on my body, obviously. Talking about it helps, and seeing other people thrive on TPN is also helpful. What are the psychological effects of being NPO? That means taking in nothing by mouth, and it is very difficult because you get a lot of cravings, at least I do, and food, so much of life is centered around food, and when you can't partake in that, it's kind of sad. It's easy to get down about when the whole family's eating and you can't eat, or your friends, they don't invite you because they know you can't eat, so they're not going to invite you to go to the fancy restaurant even though you would love to just sit with them and hang out and talk. So those aspects of being NPO can be difficult to navigate, but time, that's my best advice, is time. Just, it does get easier with time. Why does long-term TPN harm the liver, and what can be done to prevent and or treat it? TPN is especially hard on the filtering organs like the liver and the kidneys, which are designed to filter toxins out of the body. The human body is not designed to filter nutrition through an IV. We are meant to have nutritional intake through our gastrointestinal tracts. So when it's having to process high amounts of fat and the lipids, the amino acids, the dextrose content, the trace elements that contain aluminum, it's not meant to do that for long term. The lipids are the most harmful component of TPN on the liver. When someone's going to be on TPN long term, normally when they're first started on TPN, they are on intralipid, which is a lipid comprised of soy. But there are other lipid options that are easier on the liver. For example, small lipids. Small lipids contain a smaller amount of soy, along with coconut oil, fish oil, and olive oil. And with small lipids, most people who switch to small lipids, their liver numbers markedly improve. Another option to help prevent and or treat liver problems from TPN is to decrease the amount of times a week someone receives lipids. So while someone first starting out on TPN may have 7 days a week of TPN with lipids, eventually their nutritionist and dietitian will switch them to having lipids only 5 days a week or 3 days a week or even 2 days a week. I receive lipids 3 days a week. We didn't want to do that because of my weight issue, and cutting lipids also cuts calories, but for my liver purposes, that's what we had to do. TPN is also harmful for the liver when the digestive tract is MPO, and in most cases anyway, because the liver has to be stimulated to release its bile. And when that bile builds up because the person's MPO and the liver isn't being stimulated, it's not releasing the bile. So all that bile is just sitting in the liver, causing cholestasis. And that in turn causes an increase in your bilirubin and your ALT, AST outflow. So that is another reason why doctors encourage people on TPN to try trickle feeds to keep that liver stimulated. My liver issues are not entirely TPN. I do have intestinal failure related liver disease from my intestinal issues and TPN complications, but I have macrophage activation syndrome, and so I have macrophages in my liver from my liver biopsy, and that is contributing to my liver problem. But another way to treat liver issues from TPN is a medication called Actigol, and that's what I started about a month ago, and it has helped tremendously. Do you have to repair TPN at the same time every day, or can you do it whenever you want? You can do it whatever you want. Every person on TPN can be on a different cycle, is what they call it. Some people might be on 24-hour TPN, where they're literally on TPN 24 hours a day and have it running. Others, 18 hours. The goal for long-term patients is usually 12. Typically, that gives the liver enough of a break, and so it's not having to process that TPN 24 hours a day. I'm on 14 hours a day because me going a full 12 hours off of TPN gives me blood sugar issues. So we found the 14 is a happy medium. But I normally prepare my TPN at night and run it from around 8 p.m. to 10 a.m. the next day. But I've had times where I run it during the day because I want the extra energy. It's all personal preference and what you and your doctor decides. Are your digestive issues worsened by mast cell activation syndrome or caused by mast cell activation syndrome? That is a tricky question. It's what came first, the chicken or the egg? Some of both. And here's why. My diagnoses: I have Ehlers-Danlos syndrome, which is a connective tissue disorder, and it's comorbid conditions. So you'll find that many people with EDS, they also have dysautonomia or POTS, the malfunctioning of the autonomic nervous system, that they also have gastroparesis. Not all of them have intestinal dysmotility too, but many have gastroparesis, and you'll find that the mast cell disorders are very common in EDS patients too. All of those conditions can cause GI issues. When my intestines have been scoped, I have too many mast cells in my GI tract. So that shows that mast cells are playing a role in some of my GI issues. When I've had a bad reaction, I'll find that I have really bad heartburn because histamine and other mast cell mediators are released, and those are very involved in the production of gastric acid. But while I have diarrhea and reflux and intestinal pain from my mast cell disorder, dysautonomia and malfunctioning of the autonomic nervous system also causes GI issues because it controls digestion. So when you're in a dysautonomia flare, your digestion can be really fast or it can be really slow. With EDS, the tissues are so fragile and it makes it to where the GI organs can't contract properly, which causes a motility problem. So you don't know which is primary and causing that issue at that particular time, if that makes sense. This might not make any sense, and if it doesn't, I apologize. And then also, when you have a bad mast cell flare, it can trigger a flare of dysautonomia. So if the mast cell directly isn't causing a GI issue, if it's triggering your dysautonomia, then the dysautonomia can cause a GI issue. So that sounds very confusing, and I'm sorry if that doesn't make sense. But how did you know you were in intestinal failure? The definition of intestinal failure is the GI tract's inability to absorb nutrients, leaving a patient dependent on IV nutrition, TPN. That can be for many reasons. It could be due to a motility disorder and digestive tract paralysis. It could be from inflammatory bowel disease damage. It could be from short gut when you've had bowel removed because you don't have enough bowel to have proper absorption. I've had all of the above, so I have chronic intestinal pseudoobstruction. I have immune-mediated enteropathy, which is an inflammatory bowel disease from 2 genetic mutations. And I have had bowel removed. My colon was removed. I had originally had a mechanical obstruction, which is a volvulus, and that is where part of the bowel twists. And that night, I thought that I was just having a pseudo-obstruction episode, but it wouldn't go away. Normally, when I would go into a full-blown obstruction attack, this is why I'm still on tube feedings, it would relieve itself within at least 6 hours, but this had been going on over 12 now, and it wasn't getting better. It was just more unbearable. I was a dry heaving, even though I can't throw up. My fiance's like trying to go get the garbage can just in case. I almost didn't go to the ER, but by the time it just got so bad, so they called 911, my parents and my fiance. And I went to the hospital. They did this as usual, my x-ray, and they came back after the x-ray, and the ER doctor leaned down on his knees and looked at me and said that I needed to go into emergency surgery right away, and that I had something called a volvulus, and I had never even heard of a volvulus. I'm like, volvule, what? And he's like, emergency surgery, that's all I heard. And I looked at him like, originally they were supposed to only remove or go in and untwist the part of bowel that was twisted, and this was in my transverse colon was a twist. But when I woke up, I had an 8-inch incision from right here all the way down. And my bowel was too damaged for them to save. So he took almost the whole colon. He left a couple inches to try to resect to avoid the ostomy. He said the ostomy would have been safer, and he didn't know how long his surgery was going to hold. But that was what we did. He removed some small bowel too, but my bowel had been so dilated and damaged from having constant pseudo obstructions that it was just useless, and he had to remove it. That was one of my worst complications. They aren't exactly sure why I was a little more prone to the volvulus. They thought maybe because my bowel stayed so dilated, it just allowed it to twist easier. Some have thought it was my EDS. Others have thought maybe it's related to my other genetic mutations. There's no way to be 100% certain or if it was a combination of all of the above. But it happened. It was God's will for that to happen for some reason. And my liver numbers changed that day before surgery, like right before surgery. And they've just worsened since. And My life hasn't been the same. I've been on TPN ever since. Before, how do you have a quality of life when you suffer often? I just try to do what I can. It's all about finding that balance versus pushing yourself. And then you don't want to never try to do anything or have a life per se, but you don't want to try too hard and cause a flare. So it's all about finding that balance there. And I just try to stay motivated and find one small thing to accomplish every day. And that helps me not feel down or depressed about the situation. What would you say to someone who knows nothing about digestive tract paralysis? I would say you never know what you've got until it's gone, and to cherish every bite that goes into your mouth, because one day you could unexpectedly lose that ability. It doesn't mean life is over, but it's not something that anybody would want to deal with. We all have our struggles and burdens to bear in life, but digestive tract paralysis is not a fun one at all. I'm gonna go and leave it at that. Thank you for watching. Thank you for giving me questions, because you had some pretty good ones.